How is blood pressure managed during an acute hemorrhagic stroke? Imagine your brain is like a delicate garden that needs just the right amount of water to stay healthy. During a hemorrhagic stroke, when a blood vessel in the brain bursts, controlling blood pressure becomes like adjusting the water flow carefully to prevent further damage. Managing blood pressure in this situation is crucial because too high a pressure can cause the bleeding to worsen, while too low can starve the brain of vital blood supply. The main goal is to lower blood pressure enough to prevent the bleeding from expanding, but not so much that it cuts off blood flow to the brain tissue. For most patients who come in with a systolic blood pressure between 150 and 220 millimeters of mercury, doctors aim to bring it down to around 140 millimeters of mercury within the first 24 hours. If the blood pressure is very high, say over 220 millimeters of mercury, the approach is more cautious. The medical team will reduce it gradually, about 15% within the first hour, then keep it below 180 millimeters of mercury for the next day. This careful step-by-step process helps avoid sudden drops that could cause brain ischemia or lack of blood flow. To achieve these targets, healthcare providers typically use quick-acting intravenous medications. Drugs like labetalol, which is a beta blocker, or nicardipine, a calcium channel blocker, are preferred because they can be precisely adjusted. These medications are given through continuous infusions or repeated doses, allowing the medical team to fine-tune blood pressure levels as needed. Why is this balancing act so important? Because high blood pressure often happens after a hemorrhagic stroke due to the body's stress response. While elevated pressure might help keep blood flowing to the brain initially, it also raises the risk that the bleeding will get worse. On the other hand, lowering blood pressure too fast or too much can reduce blood flow to the brain, potentially causing additional injury. That's why careful monitoring is essential. Blood pressure is checked frequently to ensure it stays within the safe range without overshooting. Supportive measures also help. Elevating the head of the bed to about 30 degrees can reduce intracranial pressure, making it easier for the brain to recover. In some cases, doctors might consider medications to prevent seizures or manage swelling if needed. All these steps are guided by established guidelines from major health authorities, which are based on large studies showing that early, controlled blood pressure lowering can improve outcomes. Research from trials like Interact-2 and Attach-2 supports these strategies, showing that aiming for a target around 140 millimeters of mercury is both safe and potentially beneficial. Every patient is different, so treatment plans are tailored to individual needs, considering factors like baseline blood pressure, neurological status, and other health conditions. In summary, managing blood pressure during an acute hemorrhagic stroke involves a careful, measured approach. The goal is to lower systolic pressure to about 140 millimeters of mercury within 24 hours, using fast-acting medications and close monitoring. This helps prevent the bleeding from worsening while ensuring the brain still gets enough blood to survive and recover. Always remember, it's vital to work with healthcare professionals for personalized treatment and follow their guidance for the best outcomes.